Welcome to 2021. Is that a metaphor for how this year is going to go? Is that? Anyway, I just came out of work. It is New Year's Day. I'm in an empty parking ramp, which is oddly creepy and also kind of nice because I feel all bougie like I got my own parking ramp. Anyway, I wanted to talk to you about something cool that I saw overnight tonight, and I'm going to describe this condition without talking about the patient too much because hello HIPAA. But this patient had an operation. They had a chest tube. Things went fine. They had the chest tube taken out. They went home. Well, while they were home, one of the sutures that was holding an old chest tube site closed came, got ripped, broke, whatever. And so the patient didn't realize it, but because there was this tiny little hole in their chest, they had a whole bunch of subcutaneous air, aka crepitus, creep up through this hole. And this person, usually you get a little crepitus like around the chest tube site. This person has crepitus like all over their back, their front, their neck, their arms. And for those of you that don't know what crepitus is, it's air trapped under the skin. It's subcutaneous air. And when you palpate it, when you touch, it feels like Snap, Crackle, Pop Rice Krispies. Like, that's literally what it feels like. It's kind of cool, kind of creepy. Anyway, this person has all this subcutaneous air, and so what they've done, because the chest tube is not going to get it all out, and this is very uncomfortable, and we don't want to have a whole bunch of air under the skin. There's like a whole list of reasons that I probably don't even know the whole list of why we don't want that. So the therapy that we're doing as nurses is every 3 hours, around the clock, we go into this patient's room, and this patient has a little incision on their chest. It's an open incision. We have a dressing on it, of course, to keep it clean, but we take the dressing off, so there's this little open incision. And then the patient told me that this is what nurses had been doing, because I started with my hands and it just didn't work. But I had a long tube of tape. It's like a long cylindrical tube, and I was using it kind of like a squeegee, a soft surface, to help push, like a long surface, to help push that air up towards that open incision so that the air can literally escape. So while I was doing this, so I'm going over this person's chest, neck, arms, back, all of this, trying to push this air out, and I'm seeing air move under the skin. If you've ever seen ice on a lake, like a frozen lake, and there's bubbles underneath it, that's kind of what it was like. So as I was pushing, I'm holding my phone, so I keep pushing on the same arm. But as I'm pushing the air out, I'm seeing it little ripples of lightning or air bubbles under the skin. It was so weird and so cool. And the patient was saying that they could feel the air moving as I was pushing it out, and it was a weird sensation for them. But the difference was amazing. They were all puffy and inflated, and I was watching the air just escape. And now I want to do more research about this because I don't have a full understanding of why we would do this as opposed to something else. I think that because it was so widespread, there was no way to tap every single pocket so this was the way that it works. Of course, we have to be really careful about infection with that open site. That's key because we don't want to trade a problem for a bigger problem. So I thought it was really interesting. That's really all I got to share. I want to do some more research and figure out, it's called a gill, like a fish, a gill, which makes sense because air is moving. Anyway, I don't need to explain to you what a gill is. I'm going to try to keep this under 5 minutes, so I'm going to go. I hope you all have a wonderful new year. Please go to nursinguncensored.com/blog/2021 and read my blog about what bullshit I am not doing in the new year and what things I am doing in the new year. So I hope everybody has a great day, and just don't let 2021 know we're here yet. Maybe she won't notice. Maybe she'll behave herself. Bye, guys.